Hi, my name is Heidi Meyer. I'm a family physician here at Kaiser Permanente, and I'm one of the doctors who are doing the integrative medicine physician consults along with Dr. Ray Lane, who you'll meet in a second. I'm a proud graduate of UCSD School of Medicine, and after that I went to the University of Arizona where I completed my family medicine residency, and I was part of the inaugural class that also participated in a 200-hour integrative medicine and residency program, which was kind of an offspring of the University of Arizona Fellowship in Integrative Medicine. And I was fortunate enough as a med student to take multiple electives in integrative medicine as well. Following that, I became a diplomate of the American Academy of Integrative and Holistic Medicine in their integrative medicine specialization. And next May I'll be sitting for their board exam because there is a new board certification for the integrative medicine specialty.
And I'm Ray Lane, and I'm also a family physician. I attended medical school at UCSD and went through the residency program there, and I've been working for 31 years as a primary care physician. I developed an interest in integrative medicine probably about 5 years ago when I realized that there are a lot of things in primary care, the traditional practice, that we don't really do that well. And so, people with issues related to stress, functional GI issues, pain, all very difficult to treat with the Western traditional model. And so I became interested in looking at alternative practices that could help people. I also did some additional studying and training and took an exam through the American Board of Integrative and Holistic Medicine. So I also am a diplomate in integrative medicine.
And Dr. Lane, we also get a lot of questions about kind of what does this mean, integrative medicine, and we could probably come up with a million definitions of what integrative medicine was, but you kind of just mentioned it. It's everything. So when you sign up for Kaiser Permanente insurance, the only thing that will be covered by your benefits is what we call traditional Western medicine, things that are taught through an MD or DO program, the two types of medical schools we have here in the United States. We don't learn anything about acupuncture. We get almost no nutrition. We certainly don't get any sort of healing therapy that is outside of kind of the pill for your ill model. So we're really taught to treat symptoms, and we're not taught to really think about the cause of the disease or any long-term healing. And so integrative medicine really fills in the gaps that Western medicine doesn't fill. And it is good for those nagging conditions that your traditional Western doctor can't seem to fix. If you're tired of taking a lot of pills, we can say, okay, well, let's make sure that what you're taking is appropriate, and let's make sure that there aren't other things we could be doing to resolve the issue in the first place. I personally got interested in integrative medicine when I was having health struggles myself and going to Western physicians who went to excellent medical schools and had excellent training but just didn't know how to help me. And ultimately, after seeing specialists in different modalities, which included chiropractic, yoga, Ayurveda, and botanical medicine, I started to feel better. And so I actually became interested in integrative medicine before I was even interested in becoming a Western doctor. So we're really glad to bring these different modalities to you. And we're the ones who are able to identify what other treatments that we don't offer here at Kaiser Permanente under your covered benefit that you might want to go out and seek in order to improve your health and hopefully decrease any symptoms that you might be having.
Yes, and so when you see an integrative medicine physician, basically you're seeing somebody who has a strong background in traditional medicine, but who also has additional expertise in alternative techniques. And it's really the blending of those that offers you the best chance for improvement. Also, seeing a physician who has traditional background makes it easier for us to make sure that you don't suffer harm, that we know when alternative treatments are compatible with your traditional medical treatments, and we know when there's potential for adverse side effects or interactions. So it makes it, I think, a much safer and better experience for you.
So do you think there are any other major questions? I think we kind of covered a lot. Hopefully we haven't taken up too much of your time. If you do choose to come and see us, you'll get 15 minutes of face-to-face time with us, which is a lot more than you're allotted when you come to see your typical provider. And we're also going to spend significant amount of time on your intake packet before you even come into the room. So we really are putting a lot of time, effort, and energy into looking at you as a whole person, and that's what you'll get if you come in for a consult. We hope to see you.